Welcome. I'm Lee Doherty Biddison.
And I'm Carolyn Cumsty Fowler, and we are your co-hosts for the Johns Hopkins Medicine Office of Wellbeing's podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare.
We spend a lot of time thinking about how to influence workplace well-being in healthcare, and we're excited to share some of what we're learning.
Thank you for joining us. Welcome. I'm Carolyn Cumsty Fowler, your host for the Johns Hopkins Medicine Office of Wellbeing's podcast, and I am delighted to welcome back Dr. Elizabeth Harry, who is the Chief Wellbeing Officer for Michigan Medicine. Welcome, Liz.
Oh, Carolyn, thank you so much for having me.
And Liz and I are going to talk today about cognitive load. If you were not able to catch the first podcast that Liz did with Dr. Lee Biddison, I'd recommend that to you, because we're now going to take the next step in thinking about how cognitive load shows up in our clinical environments. But Liz, before I get into that, I would invite you, please, just to tell us briefly, how did this land on your radar screen? How did you get involved, and why do you care so much about it?
It's a great question, Carolyn, and it is, I think, a bit of an unexpected journey. But just briefly, when I trained in residency, I actually trained in quality improvement with a focus on quality improvement. And when I first left residency, I was doing a role where I was doing quality improvement. And when we did some improvement projects and had really great outcomes for the patients, sometimes our providers in particular didn't love the work. They didn't love the improvement project. And I didn't understand why, because we always talk about how patients first is so important to all of us, and it is to all of us. So why wouldn't we love something that improves their care, their safety, and their experience? And so I asked folks, and what I heard was a lot around change. And this was pre-COVID, but just change fatigue. So I got really interested in change fatigue. And as I learned more about change and the impact of change on our ability to sort of process information and having to learn new systems and learn new processes, I started learning about cognitive load. And I got very fascinated. And I felt like we had designed systems, whether intentionally or unintentionally, that were progressively overloading people. And I felt like I could see the overload in other people. You could tell when someone was overloaded and not quite with you anymore, not quite attending 100%. And I noticed that get worse over the years. So when I moved to Boston, I ended up getting a grant to look at the impact of cognitive load in a post-hospital discharge setting on errors. But one of the things that we measured was frustration when people are overloaded, which turns out is a surrogate measure we learned in a subsequent study for burnout. And so I started getting very interested in the impact of this overload on people. And then we did a study showing that there was a very strong relationship between having a high task load and burnout. So that's sort of how I got interested in it. And I think we're living in a world where the cognitive overload just increases because the data is increasing. And so it feels more and more salient every day, because I feel like we're all having to battle that much harder to sort of protect our attention.
Right. I mean, I've heard so many colleagues say that they feel like they have ADD. They're constantly challenged with where it is they place their attention at any moment during the day. How would you describe cognitive load for somebody who isn't familiar with the term?
I think at a very high level, the important things to be aware of is that we have a limited amount of working memory. And working memory is what we need really to process anything or to bring anything out of our long term memory into our ability to sort of act on it, whether it's speaking about it or acting on it, with the exception of habit behavior. And that goes in a different place. We'll take that off the table for the purpose of this conversation, although it is relevant when we talk about standardizing things. So we all have a limited short term working memory, and that is our ability to attend to things, and how much of that short-term working memory is used at any given time is impacted by the cognitive load. And the cognitive load you can think of as sort of if the short-term working memory is a cup, the cognitive load is the fluid that's filling up the cup. And there are three things that impact how much fluid is in that cup. The first is, how complex is the task? How complex is what you're doing? That's called the intrinsic load. You can't change that. It just sort of is intrinsic to the task. The second is, how much of your working memory are you spending learning the task? And so that's called the germane load. And that's the amount of working memory we're spending building mental models or learning the task. And that can change, but it takes time. It takes time to learn things. It takes time to build expertise. And we're both in teaching organizations. And when we have learners, it's important to realize that they're using a good chunk of that working memory on complex tasks to learn the task too. And then the third thing is extraneous cognitive load. And this is everything that's sort of extraneous to the task. It's not intrinsic to the way the task is itself, but it is the way the task is presented. And extraneous cognitive load is driven by three main things. So one is lack of standardization. So what I often think about is if I go into a clinic room to do a visit, and in one room things are organized in one way and tools are in one place, and I go into another room and it's organized in a different way and tools are in a different place, I have to use some of my working memory to remember that difference.
Mhm.
It's not intrinsic to the care I'm providing. It's extraneous to the care I'm providing, but I still have to use some of my working memory in order to be effective to remember that difference. And we do that all over the place, right? How we design interdisciplinary rounds varies unit to unit, all sorts of variability that leads to excessive cognitive load. The second thing that impacts that extraneous cognitive load is redundancy, and that's getting the same information multiple different ways. So I'll just give you an example. The other day, I had a patient discharge from an outside hospital facility. I got a notification about that discharge in 7 different times,
Mm.
and some paper and some electronic. And the problem with redundancy in that way is that I don't know if one of those ways fails because I don't know how many ways there are. So if we have one highly reliable process, I'll know if that fails. I'll know if I wasn't notified that this patient was hospitalized. But if we have 6 moderately reliable processes or 7 moderately reliable processes, it's impossible to know if it fails. It's excessive cognitive load. I already knew he was discharged, and that drives sort of that cognitive burden. And then the third one, which is also really salient in healthcare, is split attention. And this is interruptions. This is when we take our focus off of the thing that we're doing and we move it to something else, and then we bring it back. Or we're partially listening to 2 conversations at once, or we're listening to something and we're reading something at the same time. We are all doing so much more of this split attention. And so those big 3 drivers of extraneous cognitive load are the places that we can focus on trying to reduce some of this cognitive load for folks.
Well, I think people who are listening to this are probably recognizing their lived experience in any 12-hour shift or 8-hour shift that they're working, right? I'm struck when I'm walking around the units just how many distractions there are in the unit. It's actually frightening.
It is, and
Let's
I actually have had I had a colleague from NASA who has shadowed me twice in 2 different organizations that I worked in, and both times she was sort of horrified that we are making really, high impact medical decision making in environments that are very distracting, and it's different than how they think about trying to protect people's ability to think.
So it's interesting that you say your NASA colleague was horrified by seeing what they saw. I think for many of us, we just take for granted the way we do business. So perhaps could I invite you to walk us through what we might notice either about ourselves or our colleagues and teams in practice when we are cognitively overloaded? What might that look like?
I think the first is just trying to track a task or a concept from beginning to end. And if you are able to, say you are going to pass a med for a patient, if you are able to focus on, I'm going to pass meds for this patient, do the scanning that you need to do the documentation that you need to do, and pass the med for the patient without anything else inserting itself in that process, that would be a focused environment that would not put you at risk for overload. If you are interrupted during that process, if you end up having to do a different task during that process, that increases the risk for errors. And actually, there was a study done in the nursing literature that showed this. They had nurses put on bright orange or yellow vests that basically said, I'm doing med pass, don't interrupt me. And the med pass errors went down.
Mm.
Just this signal of like, I'm doing this high complexity task that is very important. Please don't interrupt me. Please let me focus on what I'm doing. So I think being able to track the task and see if you're able to stay on task the whole time and make sure that there isn't any interruptions in that task or that you're doing something else, I think is one good example. The second thing I think is watching your cognitive fatigue. So if we are having trouble making decisions at the end of the day, which we know is a phenomenon, a lot of that is because we haven't repleted our working memory, right? And we've sort of depleted it over the day, but we haven't taken like a cognitive break to be able to replete our working memory. We know from a paper that came out recently from John Swoller that you actually can replete your working memory if you take a break, a sort of a cognitive break. And it has to be a real cognitive break, not sort of a mindless, where we tend to do social media or email or something else. It needs to be a real break. So I think those would be two really good indications of just watching how you're doing your tasks and how often in your day are you trying to alternate between tasks. So mindful that we don't multitask. We like to say we do, but what we do is alternating tasks. And the more that you're doing that, the more that scattered feeling that comes from doing that is part of that cognitive overload.
Hmm. As you were describing it, I was thinking about conversations we've had about the challenges we're experiencing in our teams now that the ratios of experienced providers and nurses and clinicians to inexperienced or learner providers has changed so dramatically. We're now in a workplace where many of our colleagues are really quite young and quite inexperienced. I mean, they're trained, but they're in this drinking from a fire hose experience that is coming into real world healthcare. And I know it's just human nature for many of us to feel a little impatient with these learners and these new clinicians as they seem to find things so much harder than we do. What would you say to those of us who are more experienced and have an easier time with decision making because we've learned this? What would you say to us about how you would like us to work with our younger learner colleagues in this space?
I think to remember that they have a heavy germane load, right? So not only are they doing the task, they're learning the task. And, and that makes it harder. And that by definition makes them more inefficient in doing it. I think the other piece to think about there is that, when we get multiple data pieces that fit with a mental model that we have, we are able to chunk them and put them in that mental model and kind of process them as one data piece. Whereas they're not able to do that in the same way quite yet because they're still building that mental model. That means we are more efficient, but it also means we're more prone to biases and cognitive errors than they might be. So the other piece is there's a benefit there to the newness, to the freshness, to the looking at all the things as separate data pieces. And that there's a real opportunity to learn in both directions, right? And say, well, how do you see this? And do you see something that I don't see because I'm so used to doing this? And I think a lot of times our folks that are newer can look at a process and say, but this doesn't make sense. And it's like, well, maybe it doesn't make sense. Maybe we started doing it this way a long time ago because there was X pressure that we were trying to work around. But that pressure is gone and we're still doing it this way. And we never stop to reevaluate. So I think really thinking of it as like this bi-directional learning opportunity, it would be great.
Good. So we want to really encourage that curiosity and that questioning.
Yeah. Yeah. That's right.
How do the other aspects of our lives impact cognitive load? So we have cognitive load building at work, but we also live lives outside of work. Would you like to say something more about the intersection of those?
Yeah, well, I mean, we try to partition our lives to sort of have our work life and our home life, right? But our brains don't partition all that well in the same way, right? And so we know, we did a study looking at childcare stress, for example, and burnout, self-reported anxiety, depression, intent to leave, intent to reduce hours. All of those things went up if people were experiencing childcare stress. If you're experiencing childcare stress, you're worried that your children aren't in a safe environment or worried about what your childcare is going to be, you're thinking about that while you're at work. That is on, I can tell you from experience, right? So that is
Yeah.
on your mind. You're thinking about that while you're at work. You're thinking about that while you're also thinking about other things. And that is a data point that takes up cognitive bandwidth. We also know that our short-term working memory, this limited thing that we talked about, is be sh- can be shrunk or shortened if we are emotionally or physiologically stressed. So if people are having a lot of stress at home and they come into the workplace, they will have a smaller working memory that they will be able to process information with. And that's important to realize too. And then I think the third thing that's really important to realize is that in addition to that, when we are stressed and or fatigued, so I think sleep plays a really big role here. And we have some data we're starting to look at now that supports this. that your ability to manage your working memory is going to decrease as well, and your ability to sort of function from your prefrontal cortex, which is sort of your, I always say it's like your anti-toddler part of the brain, goes down. And that's our behavioral regulation, our executive functioning, our ability to plan, our ability to do high cognitive tasks such as our medical decision making. All of that's impaired. So I think really being attentive to what we have going on at home, and how are we setting ourselves up for success, what is the cognitive load that we have from home, and what are we doing to sort of make sure that that part is managed too.
Mhm. And what are some of the sort of early signs and symptoms that I should watch for if I'm at work that would suggest maybe you need to speak to somebody about taking a break? You're not optimally present here.
I think, if we notice ourselves like jumping from task to task really quickly, if we notice ourselves sort of in that scattered space, or if you catch yourself like, oh, I almost forgot that, or oh yeah, that thing, right? Like that you're kind of right on that cusp there. And so it's a good time to just, I need to take 5 minutes. I need to take a cognitive break so that I can reset. I think, one of the things that I often see from people is as we get more overloaded, we get a little less patient, and we get a little quicker to snap at folks and be frustrated about things. And so I think watching that behavior in yourself is a really good indicator too. And then if you're noticing your own sort of cognitive processes feeling fatigued, and we all sort of know that feeling, right? Where you're like, gosh, I'm zoning out, and I'm not checking in the same way. I listened to like 60% of what that person just said. I
Or I,
didn't listen to the full story.
yeah, or I just read that paragraph 3 times and I still don't know what it
Yes.
means.
Yes, yes, exactly. Oh, yeah. Or I realized I've just read a whole HMP or whatever, but I lost track of it, and my eyes were moving, but I wasn't pulling the content in.
Right. This is so fascinating. I'm so grateful to you, Liz, that you've brought this to us because, you know, we think that this is new. We think that this is a new field, but it's not, is it?
No, it's not. And what I always, feel is so amazing in academics is that we have the opportunity to really reach out to these other industries like human factors engineers and organizational psychologists. We have folks in business that think a lot about this. There are people all over the academic world that have a lot of expertise in this, and I love the idea of bringing them in to really help solve the issue. I mean, you guys are spoiled because you have the Armstrong, Institute for Human Factors in Healthcare. So you have experts embedded in your health system, which I think is wonderful. And I think where we all need to go, which is really having these folks embedded in our healthcare, educated to apply these principles in healthcare, and helping us solve what is a really complex problem.
And it's challenging that norm that it's normal to be multitasking or feeling exhausted, that this is not normal and it's not okay.
Yeah, and it's not sustainable, right? So I think, one of the things that I've watched is I used to sort of see that cognitively overloaded look on the intern's eyes, right, at the end of the day. And you could tell when if you were trying to teach them at the end of the day that they just like weren't quite listening, or they're either you weren't really able to get anything in. And then it sort of went to it was the residents too. And then I noticed the attendings too. I've noticed our nurses with it. I've noticed our MAs with it. And I think the thing is that we used to have just pockets of it. And as the complexity has increased, as the data has increased, and this is all, obviously anecdotal. I don't have anything quantifying the cognitive load of folks, but as all of this has increased, the cognitive load that we are being bombarded with is increasing every day. Our brains are the same. They're not changing. We are learning new things, but our capabilities are not changing. And so I worry about the sustainability as the complexity of our patients increase, and the number of medications, the number of medical problems, the number of things that we're trying to do. All of that is just more on brains that have the same capability.
Right. And I know that we're all very concerned about the impact of cognitive load or cognitive overload on quality and safety and the outcomes we care about. I'm also really intrigued about how it's impacting the quality of life of the people who are doing the work of healthcare. Because I've had people say to me, as things become more complicated, as technology has become more prevalent in healthcare, The things that gave me joy and meaning in being a healthcare provider have got squeezed out.
Yes. Yeah, I think you're exactly right. And I think there's a couple pieces there, right? So, one, we want to be very attentive because those outcomes to deliver excellent care, that's why we all came into healthcare. We all want to deliver excellent care, right? And so those outcomes really matter. But to your point, we were sort of chatting about this before, is that the, person is the delivery of the health care, right? And so we can't lose that person, as you said, which I thought was really brilliant. We can't lose that person in the middle, and we can't lose attending to what is their experience in delivering that high quality care, and how are we making sure that it's sustainable, and how are we making sure that it's something that they can do safely, and for a career, right, for a long period of time. So I think this piece about the more and more that's added, the harder it is to find the pieces that bring meaning and joy is really important. I also want to just add a second piece that I think is important to name. There is this little reinforcement, a little dopamine hit of multitasking, a little dopamine hit of checking the emails, a little dopamine hit of having this sort of urgency cycle that we live in.
Mhm.
And I saw this great talk by a Navy SEAL once where he said, I think I was living in fight or flight for 20 years straight. Right. And so I do want to also have us watch ourselves of when is it that we're getting that little reward for being in kind of this frenetic state that's keeping us in this frenetic state, and sort of is keeping us from wanting to sit down and focus, in a more focused manner, rather than sort of like running all over the place and balancing all these competing priorities. So I do think some of it is a little bit self-driven because of that reward pathway of that urgency cycle.
So we feel super productive, or we think we're productive. We're just getting reward after reward. This is an interesting conversation that we've had in the Office of Wellbeing quite a lot, which is our drive in healthcare to be doing. We measure our doing and we like to count our doing, and we have meetings about our doings, and we tend to ignore our beings. Like, how
Mhm.
are we showing up? How are we showing up in our work, and how are we showing up in our relationships in healthcare? How does cognitive load influence that piece of our being?
Yeah, I mean, it's a really good point, right? Like, I think you can spend a whole day doing a lot and not actually advance what's important. And I often talk to people about, that priority matrix, urgent, non-urgent, important, non-important, right? And it can be very tempting to stay in this urgent lane and not dip into the important. And so I think, when you're overloaded, you can really miss the things that are important to you, whether it's personal or professional, whether it's making time to write that paper or read that paper or attend that class or sit down and talk to that patient, really talk to them about, you can tell something else is going on, or attend to relationships, or build something personally that is important to you. Those things get squeezed out at the edges if when we're in this sort of overloaded state. I think many people have seen that visualization, right, where you have a big jar, and if you try to put all the sand in first, then none of the rest fits. But if you put the big rocks in first and then the pebbles and then the sand, everything fits. And so this idea of making sure that we're prioritizing where we're paying attention and that it's in line with our values, because you can justify having your attention be grabbed from you to the end of the earth, right? Well, they needed me, and they needed me, and this needed me. And, well, that'll always be the case, and it's going to get worse, right? And so at some point, we do have to have some intentionality around, these are the things that I need to accomplish for this patient today, or these are the things that I need to get done, for my research career today, or these are the things that I need to do personally today that are most important. And if I can't attend to something else that is urgent, is there a role there that can, is there someone that can, or do we need to look at the systems and say, we can't do all of this. So what do we want to do? And be intentional about it. I think we're in this space where we have gotten to a point where we have to prioritize. We have to say, what are we going to do when there's situations of competing priorities?
Right. Well, perhaps as we begin to wind down, could we just transition a little bit to some real practical advice? As somebody who's lived in healthcare, you've become aware of your cognitive load, but you've acted on trying to do something to reduce the cognitive overload. Could you just give us some practical tips of things that we could try to reduce our cognitive overload?
Yeah, so I really try to focus on those three buckets of extraneous cognitive load and then paying attention to where I pay attention to. So, in terms of standardization, I try to standardize the way I see patients in terms of when I go through the chart, how do I go through the chart? So, I do it in the same way every time so I can make a habit. And then that habit turns into long-term, goes into long-term working memory instead of short-term working memory and doesn't take up that space anymore. I try to standardize things at home, right? So where do I put my keys? And we have something in our house where we basically eat the same 5 meals, week after week because we know the kids will eat them. But it's just sort of adding that standardization. I will name there that people have a tension around standardization and say, well, I don't want to do cookbook medicine. The way that I think about it is we should be standardizing everything that's low intrinsic load so that we have the cognitive bandwidth to think about the really sick, really complex patients and give them the cognitive attention that they need.
Mhm.
So I think that piece is really important. So that standardization I try to do a lot of, and building routines for me really helps in that space. So thinking about the routines. I try to be very protective of my split attention, right? So I try to watch myself. I'm a human just like everybody else. So my attention gets dragged away and is being pulled on constantly. But I've tried to turn off alerts on my phone and try to make it so that only a few things can come through. Obviously, patient care notifications have to come through, but really being clear about what interruptions I want during the day and what interruptions I don't want and where I will spend that time. Some of that is like chunking tasks like email. So I do not send an email all day long. I will do it a couple times a day and I do not get to every email and everybody who's ever emailed me knows that. But it's just a personal choice around where I can pay attention. And then I also personally have made the priority of trying to spend focused attention time with everybody who's important to me in my life, in my family, to make sure that I am prioritizing those things that are values to me so that I don't feel like I'm compromising those on behalf of my job, which I do think exacerbates that sense of burnout and moral distress around what we do.
Because I mean, that gift of presence, that's the most important thing you can give another human being, whether it's a patient or a child, right?
Yes, yeah, that's right.
Well, I'm I'm gonna have this as be the last question, but and the reason I'm asking it is I'm reminded of the times that computers lock up or computers start malfunctioning. And the advice is always just switch them off, give them a minute or two, and then switch them on again. And that would seem like a cognitive break to me. So, could you describe for us as we wrap up what is a true cognitive break and what is not a cognitive break?
So I think I'll start with what's not, right? So it's very tempting to use that time to check email or to check Instagram or to check the news or Facebook or whatever social media you use. And that is not a cognitive break. And in fact, it sort of adds to that urgency cycle with the little dopamine hits that you get from it. So things that you can do are things to actually relax your focus. So a lot of people ask me, would meditation be helpful? Perhaps if you're an experienced meditator, it can be. But for people that are new at meditating, who are new at training their mind and training that focused attention, the goal is to give yourself a break from attending because you had just done a period of focused attention. So you don't then want to then do an exercise where you're focusing your attention diligently for 5 minutes again, right? So instead, the opposite is what's called, the mind wandering, which allows the part of your brain that's called the default mode network to activate, which is sort of the opposite of focused attention. And you can just sit there and let your mind wander for a little bit. Going for a walk while you do that, so changing your physiologic state is
Mhm.
really helpful. I like to listen to music, so I'll put in music in my ears and just go on a walk and just let my mind wander. And it just kind of then runs through everything and it seems to discharge some of the redundant thoughts that can come through. So those are things that I do that I think are helpful. And I think this concept of mind wandering is helpful too.
Just letting ourselves imagine, perhaps even imagine what we're going to do when we're not at work,
Yeah, yeah, yeah. And
as
just
long as
take a
it's not
little
a
bit
to
of
do.
yeah, but the point is that it's not focused attention because you want to then be able to come back and focus your attention again. So you're trying to give that a break.
And about how often should we be aiming to take a short cognitive break?
Yeah, so there isn't literature that I'm aware of yet on exactly this timing. I think there are some habits out there, like people use these Pomodoro blocks that are 25 minutes of focused attention and 5 minutes of break. I think all of us have different skills in focused attention. So some of us, and I think we're learning this with our kids and the way they are being educated, I think have shorter attention spans. And so, you need to kind of understand what is your cognitive limit in attention. And you can train that and you can grow that over time like we talked about, with meditation, you can grow the ability to have focused attention. But you need to know what yours is and then give yourself a break sort of before you hit your limit and then come back. So I really do think it needs to be a bit individualized.
Liz, thank you so much. Every time I talk with you, I learn something new, and I'm even more excited about this topic than I was when I first heard it from you. And thank you
Oh,
so
thank
much
you,
for being
Carolyn.
such a friend to us in the Office of Wellbeing. We're
Oh,
really
yeah.
grateful for your partnership.
Well, you guys have an incredible office, and I consider you all friends, and I love getting to chat with you. So thank you so much for having me on.
Thank you, Liz. This is Carolyn Kamsty-Fowler, and I'm going to sign off today from our conversation with Dr. Elizabeth Harry, who's the Chief Wellbeing Officer for Michigan Medicine. Thank you, everyone. So that's it for today. If you enjoyed what you heard, please share this podcast with a colleague. And as always, we welcome your feedback.
If there are any topics you'd like to hear about, please email your ideas to us at owb@jhmi.edu.